from where its intended path, where it's supposed to go. So taking a medication and instead of giving it to the patient, then taking it for yourself or selling it to somebody else. Now, when it comes to in hospitals in particular, that would be a healthcare worker, whether it is a pharmacy technician, a pharmacist, a radiology technician, a physician, a nurse. If any of those people that have access to the medications, instead of administering the drug to the patient as they are supposed to do, take it for themselves, either to ingest themselves or to sell it, then that is considered drug diversion. Now, drug diversion can be with any drug. It could be with a Tylenol tablet. We would probably typically call that theft, right? But it's still drug diversion. And the area of drug diversion where my expertise is and that I focus is drugs that are addictive medications. We hear a lot about opioids, opiates on the news. So those types of medications, benzodiazepines, the things that are highly addictive. And so if a healthcare worker was diverting those types of medications, then we have a real safety issue, because if they're diverting to take themselves and then they're working while impaired, we've got a safety issue for the patients, for the hospital, and for the addicted healthcare worker themselves.
Okay, thank you for explaining that. That seems really dangerous if a worker was working under the influence. So surely there aren't a lot of healthcare workers that are diverting, because they especially would know the effects that this would have and the danger to take those drugs.
You would think that would be the case, but we have to remember that a healthcare worker is really just like the general population. And there are some differences, which I will point out, but the general population, there are people that have a higher risk for addiction, and that is no different with addicted healthcare workers. The Nursing Association tells us that 10 to 14% of nurses have a alcohol or drug addiction problem. So that's a pretty high percentage, really, if you do the math. And it's the same for all the disciplines, pharmacy and physicians and any of the disciplines that have access. The other issue is that, like the rest of the population, those healthcare workers have sports injuries, they have dental procedures, they walk away with a legitimate prescription from a physician to take during their recovery. And if they are one of those people that have a higher propensity for addiction, then that's what happens. They start out with that legitimate prescription and then move on into addiction that then they can't control any better than the person that is not a healthcare worker that is addicted to medications. The other thing is they have access to the medications. They're there at the hospital day in and day out where we have medications, and they have access. The general population doesn't have that kind of easy access. So in some ways, it's easier for the healthcare worker. They have stressful jobs. It's not easy being in a hospital and taking care of patients. So there's a lot of stress, not to mention any other stressors that are in their lives that they may be going through. So all of those put together. But then on top of that, I think what you also have are people who are very comfortable with these medications. They know that there is a time and a place to take these medications. They are administering these medications to their patients on a daily basis, multiple times a day. They see their effectiveness. They see the relief that these patients get. And so I think that in some cases, you have a healthcare worker that had no intention of getting involved with this, but they want some of that relief. They've had a bad day. They have access to it. Look what it did for patient A. And I just want to feel that relief just for a small moment. And that's how it gets started. So yes, you would think that they would be very educated in all of the dangers, but unfortunately, it doesn't work that way.
That makes a lot of sense if they have that easy access and they know how to use the drug, and it would just be an easy out. So it sounds like monitoring for diversion is really important. So do most hospitals already have a system like this in place? I would assume so, since it's such a big part of the hospital.
I wish we could assume that. No, that is not the case. In fact, I am amazed regularly each time I find a hospital that does not have a program. And I think there's really three main buckets that they fall into. There are the hospitals, whether big or small, that have a phenomenal program. They have devoted the resources to it. They have filled the gaps, because it's not just about the person who's taking the medications, but it's about preventing all of those opportunities, minimizing those opportunities for theft of these meds. And so there are hospitals that have taken that very seriously. And then on top of that, they are monitoring for diversion, whether it be manual audits of their healthcare workers, or if they've been given the opportunity to purchase one of these drug diversion software packages that are now on the market and can be excellent and really work well. So those are those hospitals, and they're really doing a phenomenal job. Then I would say you've got your hospitals that kind of fall somewhere in the middle, that would tell you that they have a program. They may have something in their policies and procedures that would indicate that they have a program. They may do a little bit, maybe even as little as 10% of what they should be doing, but they are doing something, and they would say, yes, we have a program. But really those programs are not very effective. And when I go into those hospitals, then we can see where, even though they think they have a program, there's just so much more, and it's really not effective, and it's not really catching anybody. Then there are the hospitals that don't have a program, and they wouldn't even say that they have a program. They don't have a program because maybe they haven't had a case of drug diversion, and so they don't want to devote the resources. They don't have an expert to do it, and they don't see the need for it. And so why? And this is a shame, because really, if they don't have a problem, it's because they are not looking for the problem. Because if you look, you're going to find it. Those statistics tell us that we are going to find it. So there's really three different buckets, and you would hope that everybody would have a comprehensive program, but unfortunately, that's not the case.
Yeah, people who think they don't probably just don't know about it.
Mm-hmm.
Okay, well, thank you so much for joining us today. I really look forward to your future vlogs where we dive deeper into these topics. RXpert Solutions plans to have other experts in the healthcare field that offer different perspectives based on their expertise. If anyone watching has any questions or suggestions on what you would like to see here relating to drug diversion, monitoring, and or prevention, please reach out to Terri. Her email is tvidals@RXpert Solutions.
Thank you, Alicia.
Thank you.